when you think of someone who's vomiting, you might picture someone with a stomach bug, but there are many conditions that can cause this symptom, from food poisoning to migraines to motion sickness to pregnancy. Even migraines can cause vomiting, and it can be hard to know how to respond to this symptom unless you know what's causing it. Vomiting is a common symptom that can be caused by a variety of conditions, from a simple stomach bug to more serious issues. The primary goals of treating vomiting are to prevent dehydration and to address the underlying cause. Let's take a closer look at how to treat vomiting. For most cases of vomiting, such as those caused by a viral illness, these self-care strategies are highly effective. They're also the first line of defense against vomiting. That is a side effect of taking a certain medication. Preventing dehydration is the most crucial step. Vomiting causes the body to lose a significant amount of fluids and electrolytes. When you lose fluids, you may also lose important minerals like sodium and potassium. Vomiting also makes the body think it's being poisoned, which can make the cycle of vomiting continue. So, preventing dehydration will help your body fight off whatever is making you sick while replacing the lost fluids and electrolytes. Sip clear liquids slowly. Start with small sips of clear liquids like water, clear broths, ginger ale, or oral rehydration solutions. Drinking too much at once can trigger more vomiting. Sucking on ice chips or popsicles can also help. Avoid certain drinks, sugary drinks, fruit juices, especially acidic ones like orange and grapefruit juice. Alcohol and caffeine should be avoided because they can irritate the stomach. Rest your stomach. Avoid solid foods. Don't eat any solid foods for the first several hours or until the vomiting has stopped. As you're sipping clear liquids, wait at least 15 to 30 minutes after you finish sipping before trying to eat anything solid. It's better to have smaller, more frequent meals. You may need to start with soft foods and work your way up to harder foods as your stomach gets stronger. Once you can tolerate liquids, slowly start eating bland, easy to digest foods. The brat diet is a classic recommendation: bananas, rice, applesauce, and toast. Other good options include crackers, clear soups, and gelatin. Get fresh air. Sometimes a change of scenery and fresh air can help. Try going outside for a bit or opening a window. If you can't go outside, aromatherapy. Some people find that inhaling scents like peppermint or ginger can help relieve nausea. Acupressure, applying pressure to the P6 point on the wrist, can help reduce nausea for some people. This point is located on the inner forearm, a few finger widths below the wrist. To find this spot, place 2 fingers on the wrist where the pulse is and move them slightly up and to the left. Apply firm pressure to this spot for 2 to 3 minutes. You can use your fingers or thumb or buy an inexpensive wristband that applies pressure to this point. When to seek medical attention. While many cases of vomiting resolve on their own, it's important to see a doctor if you or someone you are caring for experiences any of the following: signs of dehydration, decreased urination, dark-colored urine, a dry mouth, and extreme thirst. In children, sunken eyes and a lack of tears when crying are also warning signs. Vomiting for a prolonged period. If vomiting lasts for more than 24 to 48 hours in adults, or a child is unable to keep any fluids down. Severe symptoms. If vomiting is accompanied by a severe headache, stiff neck, high fever, or severe abdominal pain. Vomiting blood or material that looks like coffee grounds. Suspected poisoning or drug overdose. Medical treatments. In more severe cases, or when vomiting is caused by a specific underlying condition, a doctor may prescribe medication or other treatments. anti-nausea medications, antiemetics, are used to control vomiting and are often prescribed for severe cases or when vomiting is a side effect of other treatments, such as chemotherapy. In some cases, a doctor may prescribe a medication to help prevent vomiting after surgery. These medications are called antiemetics. There are several types of antiemetics, including medications that affect the part of the brain that triggers the vomiting reflex, medications that prevent the release of substances that cause nausea, and medications that replace or increase the levels of substances that naturally reduce nausea. Intravenous IV fluids. If a person is severely dehydrated and unable to keep fluids down, they may need to receive fluids directly into a vein in a hospital setting. The underlying cause. The most effective treatment is to address what is causing the vomiting. This could mean antibiotics for an infection, surgery for a bowel obstruction, or other specific interventions depending on the diagnosis. Thanks for watching. When you need medical advice, you can reach out to a healthcare professional. You can also search for verified information from reputable sources online. Vomit is a symptom that hopefully we'll all experience only rarely, but now that you know how to treat it, you'll be ready if it happens to you. This is The Nurse Daily Dose.